Hi, I'm Carly Reid from CX Today, bringing you all the latest news and conversation from the customer experience technology industry. Now, today I'm talking to Martin from Content Guru, and we'll be discussing CX and the healthcare sector. Welcome, Martin.
Thanks, Carly. Pleasure to be here.
It's a pleasure to have you with us today. So, Martin, how about we kick off with a quick intro? Tell me about what you do.
Sure. I'm Martin Taylor. I'm co-founder, deputy CEO of Content Guru. We are a cloud technology provider in the field of customer engagement, customer experience, best known for our Storm Cloud contact center.
Fantastic stuff. So, Martin, what conversations are you having with your customers at the moment about how COVID has affected the healthcare sector?
Yeah, I mean, healthcare is a sector we've been really developing over the last 5 or 6 years now. And it's a fast expanding area. So, I mean, last year we had healthcare revenues go up by over 40%, probably going to be something similar this year. So we're having more conversations, bigger ones would be the other part of it. So we started off in kind of small edge of the picture type applications, and now things we're doing are really at a national level, where they're looking at real kind of digital transformation across the whole country. And I think that's where we obviously aimed to get to, but things in healthcare move pretty slowly generally. But yeah, what we have seen is a speeding up of the pace over the last 18 months or so. Definitely fair to say that. So more conversations, more interesting and bigger conversations would be my summary there.
Thank you, Martin. And sorry, I don't mean to interrupt you there, but I mean, what challenges do you think that the industry has faced during the pandemic? And do you think that they're any closer to winning those battles?
Yeah, well, I'd probably move it into two subcategories, really. One has been scale, so scaling suddenly to deal with the unexpected. So obviously the pandemic, everyone had talked about a pandemic. I mean, we've all seen the movies, but when it came down to it, it did surprise a lot of people, just the speed it took hold. So there was a thing called the National Pandemic Flu Service that had been in place for years, and this was seen as what would be switched on to deal with a big outbreak. But when it came, it was so sudden and so fast moving that service was never really activated. So it came down to people like us in the cloud who are running urgent care communication services for NHS to deal with it. So we suddenly found in London in the early days of the pandemic, we were suddenly dealing with 500% traffic, but 1400% volumes. And that's because the people downstream from us, ambulance trusts, etc., weren't able to deal with that capacity. So scale was and will continue to be important. And the second part of it has been about reducing face-to-face contact. So initially it was about clinicians wanting to keep safe. So obviously if a doctor goes and sees someone and catches COVID, then they're pretty much out of action. Possibly they get very ill, which would be even more serious. Also patients not wanting to gather together. So everyone's always hated waiting rooms and kind of hanging around for 4 hours to get seen. But then in the pandemic, that became an actively dangerous thing to do. So, those two areas really, the face-to-face and the scale, have been the two big themes that have come out of the pandemic.
And how do you think that cloud technology is transforming areas like urgent care and mental health? I mean, so many people obviously struggled with their mental health during lockdowns. What do you think about that, Martin?
Yeah. I mean, urgent care obviously was at the pointy end, so people were calling 111, and the 111 services in much of the country are run from our platform. So we're across quite a lot of what was going on there, not just at the early stage in London, but as it rippled out around the country. So urgent care became about streamlining people from calling 111 through to being treated, and the ways in which they were treated changed. So in particular, video came in. So in the 25 odd years I've been working, video's always been the next big thing in technology, but it's never really taken off. Suddenly you had a reason why you needed video. So urgent care went from theoretical discussions about video that we'd been having for years to suddenly, okay, we need video right now. We need to use the patient's own device. We need to not have booking. It's got to be ad hoc. The clinician has to decide, and it's got to be really easy for them as well, just to activate when that video is going to happen. It's got to be safe, of course, because it's not just a tech story and GDPR, but we're also talking about clinical safety. So everything around health has to have a clinical safety case now. So probably fairly unusually among tech companies, we employ doctors and other clinicians, as well as information security professionals, to make sure what we're doing is safe. So that's kind of a rough summary of the space there. So video, streamlining people into going to hospital more effectively, so they're not kind of queuing up when they get there. And then mental health, that was the other kind of big thing that came up. Mental health long been a Cinderella service, I suppose, of healthcare, but lots of people's mental health suffered, and we were asked to bring in very rapidly new services for new NHS, particularly mental health customers. So we stood up one NHS Foundation Trust in 9 days, from initial conversation, onboarding, putting them on the cloud platform, putting up the crisis line, and connecting that through to the local urgent care service. So that simply wouldn't have been possible without the cloud. We never met them. We still haven't met them, actually. But yeah, we've been working very effectively for a good year or more now. So that also has led into some evolution of services for mental health. One would be on the video side again, so stuff that we've done for urgent care becoming used in mental health. The first urgent care video services were one way. The clinicians didn't want to be seen at home or in a call centre. Obviously in mental health, you want to see your clinician. So two-way video was introduced pretty rapidly, and pretty much all interaction on urgent care and mental health is now two-way, interestingly. So things move on quite quickly and presumptions are kind of overcome. The other thing that's starting to take root now in mental health is community prescribing. So sometimes instead of a box of Valium, you might be better off with a membership of the Bowls Club or something. So a lot of the isolation that's come about in the pandemic has kind of fueled these problems that occur when people don't socialize. We're humans, we're social animals. And so that social prescribing again has gone from being a theoretical concept to now having its own framework, actually, as part of the HSSF framework, which we're on with one of the main providers of these services. So mental health's definitely come into its own now, and now we're talking about connecting up mental health, not just with urgent care, but with police, for example, as well. So we can cut down the number of Section 136 incidents that happen in the streets. So rather than going in the back of the police van, you're a lot better off just talking with a mental health professional there and then. So lots of these services that are multi-agency and multi-system, suddenly the cloud makes those possible, and the pandemic has made them necessary. And again, once you've seen these things, you don't unsee them. So these are permanent changes that are coming into the system.
Great stuff. So it sounds like you guys have been very busy, Martin. Thank you for sharing that with us. My only worry, Martin, is that I don't think that the industry has enough tools in place to cope with a winter surge in COVID cases. How do you feel about that?
Yeah, I mean, every year the health system has winter pressures, and they're very real. It's not just something they make up because they want a pay rise, but the system operates right on the limit of what's possible. And of course, it's under extra strain this time because there is an increasing caseload of COVID. There's the back to school factor. People have been to festivals. People have been socializing, going to football now. So what's expected is an increase in the amount of cases, maybe a fifth wave or however many it is now. Plus our immune systems are down because we haven't been socializing as much. That could mean a much worse than normal flu season. So that kind of confluence of forces is something that's going to hit quite hard, I think. So naturally, they are preparing for this within the health system. Whether they could have all the tools, who knows? You can never have everything you need. But what will be available now will be better guidance from urgent care into checking into the emergency department. So we're reducing the number of unheralded, as they call them, arrivals. So people just rocking up. So you'll have more of an appointment. But of course, it's not, you don't just have an appointment in urgent care, because you may be expecting to go in 2 hours' time, but there could be some more urgent cases arrive in the meantime. So actually the kind of flexible queuing that we are used to in the contact center world, that's perfect for this physical queuing. So yeah, we've already seen some very successful early examples of booking into hospitals, reducing queuing, reducing people gathering together in waiting rooms. And whoever liked an A&E waiting room at the best of times? So there are definitely going to be improvements there that will be noticeable at a patient level. There'll be more video as well, of course. You read about 50% of GP appointments are virtual, but actually a lot of these face-to-face appointments weren't necessary in the first place. It's just now that it's a lot more convenient to do a quick video at home rather than to actually go and wait in a waiting room and see someone. Or it might be you've got a rash. A doctor can tell within a few seconds what it is. So let's save ourselves all the time. So I think a lot of these hard-won advances are going to be consolidated this winter, yeah.
Fantastic. So, Martin, you touched on video a little bit then. Can you tell us a little bit more about Content Guru's video consultation technology and maybe how it's changed the way that clinicians interact with their patients?
Yeah, sure. So, as I said, video is something we've been talking about for many years. There had always been information governance would kind of come in and stop the party as soon as you started talking about video. And, you know, data privacy, impact assessments, etc., are very important. We've seen some massive fines for GDPR contraventions, for example. It was $225 million for WhatsApp from the Irish government just the other day. There was a kind of $800 odd million Amazon fine. So it matters if you lose data in a commercial way or you misuse it. But if it's misused or lost or leaked in a medical sense, that's massively important. Of course, for the clinical safety side as well. So we managed to cut through a lot of this and really shortcut years into weeks in 2020. And thanks to one or two of our customers who are kind of willing to put their neck on the line, people like Huck, the urgent and emergency care provider for most of the east of England, 3.5 million patients across several counties. They absolutely saw the need early on. They wanted to reduce base visits, wanted to reduce doctors getting in cars and seeing people, wanted to reduce people just turning up and loitering around en masse. So video, something they fast forwarded. They worked closely with NHS England, NHS Digital, our own clinicians. We put together at high speed clinical safety cases with data protection, impact assessments, etc. We're able to get to launch with a safe ad hoc video product that works on customers' mobiles, whether they're Android or Apple or whatever, or whether it's an iPad and you've emailed the link. That was all done within a matter of weeks and then fast-tracked through all the NHS approvals. So that's been tremendously successful. And in fact, NHS have created a framework for that, DFO, CVC, another kind of catchy named framework, which again we're on. So it'll be a lot easier for NHS organisations to kind of draw down those services now after this kind of Wild West period that we saw last year. So we're now working on lots of interesting new developments. Actually, with that same customer, we're doing a natural language processing AI pilot at the moment. We're aiming to cut over 1 minute actually off each 111 call, which is massively significant in about a 10-minute call. It opens a new case, it puts it down to the health advisor. So all of that kind of checking out who you are, do we know you, have we got a record, all of that can be cut through immediately. So I think without the pandemic, those sorts of shortcuts, in a good sense, wouldn't have happened.
Great stuff. Well, thank you so much, Martin. I've really enjoyed speaking to you today, like I always do. Thank you so much for joining me.
Absolute pleasure.
Brilliant. And well, that's it from us. If you've enjoyed our conversation, then please do give us a shout out on social. And if you're a CX fan and want to see more like this, then you can subscribe to our weekly newsletter, and that's at cxtoday.com. I'm Carly Reid from CX Today. Thanks for watching.